You only have 4 hours to effectively halt a stroke or even reverse its effects. In this talk, I would like to explain. I'll tell you exactly how your brain has a golden rule. Nothing is more critical than time. When a stroke happens, every minute counts because in each minute, nearly 2 million neurons die, and once they're gone, they don't come back. But the good news, and the reason I made this video, is that there's something called the golden window. The golden window refers to those first 4 hours during which doctors can almost work miracles and stop or even reverse the damage. But for these things to be done at the hospital, you first have to properly fulfill your essential responsibilities at home. I am Dr. Koob, and for many dedicated years I have had the privilege of serving you in the cardiology, cardiac surgery, and ICU departments. In this video, I want to tell you exactly what you should do during those 4 hours, how to recognize a stroke, how to react, what to do, and what not to do in the event of a stroke. In a stroke, brain neurons die because the blood vessels experience a sudden and severe malfunction. 8 out of 10 strokes are due to a blockage, which is what is medically referred to as an ischemic stroke. An ischemic stroke happens when a clot or a tiny piece of debris travels through the bloodstream, reaches the brain, and suddenly blocks a vessel. Blood can't pass through, oxygen doesn't reach the neurons, they suffocate and die. A much smaller percentage of strokes are due to bleeding, meaning one of these tubes or vessels ruptures. It suddenly ruptures, blood forcefully bursts out under pressure, severely crushes the brain, and causes permanent damage. Why am I telling you all this? Because when you get to the hospital, the first and most important thing the brain specialist does is figure out which type of stroke has happened to you, because their treatments are completely different. You don't need to be a doctor, you just need to do your part correctly at home, which is actually very simple. And I'll tell you step by step exactly what you need to do. First, take a good look at their face, give them a warm smile, or ask them to smile back at you. If the smile is the same on both sides of their face, that area is fine. But if one side of the face is drooping, that means it is a stroke until proven otherwise. The next part is the eyes. Suddenly vision in one eye is reduced, you see double, or one of the eyes is deviated. Sudden vision problems have occurred. These are warning signs. The next part is speaking. Strange speech is very common in strokes. Ask a simple question. For example, ask, "What day is it today?" If they answer in a way that sounds drunk, dragging out words, or their speech is nonsensical, then slurred speech is a warning sign. Tell them to raise both arms and hold them up. If one of the arms suddenly drops down, or they can't maintain its position, or the same thing happens with their legs, this means sudden weakness and it's a critical medical emergency. If you see any of these symptoms I mentioned, don't wait to see if they get better or not. This is an emergency and should be considered a stroke until proven otherwise. And here I want to get rid of a very dangerous misconception. Many people have these symptoms for 10 minutes, then they get better and say, "Well, it was just a bit of dizziness." No, that could have been a transient ischemic attack, a kind of mini stroke, a warning that the real earthquake is on its way. So if you have any of these symptoms, go see your doctor. I always say this. A false alarm is better than the terrifying consequences of ignoring it. Even if you think it's not that important, it's better to see a doctor. Now that you've recognized the symptoms, what should you do? The global guidelines are very clear. First of all, call emergency services right now. That means as soon as you see the symptoms, you should call emergency services. Don't try to drive yourself or take someone else, especially if the ambulance can get there quickly. Why? Because the emergency medical technicians can notify the hospital and choose the most suitable center. They alert them that there's a stroke patient, prepare the medications, and can even announce a stroke code. Many large cities have special stroke preparation protocols, and that's a truly great system. When you arrive and they've been notified in advance, the CT scan is ready, the specialist is waiting for you, and this is a critical time. It's that golden window that can save your life. There's also an important point. If you can, remember the exact time your symptoms started. It's very important, especially for prescribing the medications they're going to give you. Now, there are also things you should never do. First, don't give them any food or water. If someone has had a stroke, don't give them food or water, and don't tell them to drink tea to calm down. No. Many stroke patients suddenly lose the ability to swallow. Water can go into their lungs and cause pneumonia. Second, don't lower their blood pressure. Often during a stroke, blood pressure goes up a lot, and that's not necessarily a bad thing. The body is trying hard to get enough blood to the brain. If you suddenly lower the blood pressure, blood won't reach the brain. Even doctors prefer the patient's blood pressure to be 180 or 190 millimeters of mercury. Third, you've probably heard on social media that you should prick the fingers with a needle. This is a superstition. It has no scientific basis, it's painful, wastes time, and increases the risk of delayed treatment. Don't do this. At the beginning, I mentioned the golden 4-hour window. Why? Because during this time, most of the damage can be stopped or even reversed. Experts around the world agree that the best treatment for ischemic stroke, which is a stroke caused by a blockage, is a powerful medication called a thrombolytic that is injected through a vein. This substance can dissolve the clot and reopen the vessel. But this drug is so strong that if it's given after 4.5 hours, it carries a high risk of severe bleeding. It can even be worse than the stroke itself, meaning if you arrive late, the golden window closes and unfortunately, the situation becomes more critical. If you arrive on time, they do a CT scan to make sure there's no bleeding. There's no bleeding. Then they give you this medication and you might leave the hospital almost healthy and upright without any complications. Sometimes, depending on the location and size of the clot, there's another advanced method called mechanical thrombectomy, where they send a thin tube from the groin all the way to the brain and remove the clot with it. It's like using a tiny vacuum cleaner to suck it out. This procedure can even be done several hours after the stroke starts, but my golden advice is, if there are several hospitals around you, go to a place that has a stroke unit, or a bigger hospital where there's a CT scan and an on-call doctor. Smaller centers might just waste your time. And one more thing. The best kind of stroke is the one that never happens. And here's a surprising statistic. At least 8 out of every 10 strokes are preventable. There are 4 habits that are the most powerful actions for prevention. First, blood pressure. High blood pressure is the silent killer. Get your blood pressure checked. If on most days your reading is above 140/90, write it down every day and keep track of it. When you see 5 or 6 high readings, take them to your doctor to control your blood pressure, whether through lifestyle changes or medication. This is the most vital thing. Second, arrhythmia, especially atrial fibrillation. If you are over 65, check your pulse, or if you have a smartwatch and it tells you your pulse is irregular, go see a doctor. Many clots originate from the heart and are preventable. Third, cholesterol and blood sugar. The same old advice. Eat less flour, less processed food, less sugar. These all increase the risk of stroke. Fourth, exercise 40 to 45 minutes a day. Do both aerobic and strength training exercises. The idea that I'm too old now is just an old myth. There's a suitable exercise for every age. Exercise reduces the risk of stroke, diabetes, and high blood pressure, and it also improves your sleep. It also significantly enhances your overall mood. If there were a completely free magic pill, it would be exercise. I know it. Stroke is scary, but paralyzing fear is even worse. Today, I gave you the awareness you need to take action. Don't forget the symptoms I mentioned: facial drooping, eye issues, strange speech, and sudden weakness. Remember them in order. Don't hesitate. Call emergency services right away. They could be the lifesaver for your brain, your father, or your loved one. Thank you for staying with me until the end of the video. Please don't forget to like and subscribe. Watch these videos for more information. Until the next video, take care.